Hello and welcome to the Health Show. Today's programme is all about safety, how good advice along with some ingenious inventions can reduce accidents and prevent health emergencies. Coming up, finding out if the drugs that you're buying are safe using text messaging. Working with traditional Islamic designs to protect women from car accidents. The midwives in Bangladesh who are trying to save the lives of high-risk mothers and their babies. And bringing health education to remote communities in Africa. The World Health Organization believes that up to a third of drugs now on sale are counterfeit. These fake drugs often have little or no active ingredients in them, or worse still, they sometimes contain dangerous chemicals. As counterfeiters become increasingly sophisticated, it's getting harder to distinguish fake from genuine drugs. So the pharmaceutical industry is being forced to come up with new ways to prove that their drugs are the real thing.
Over the years, the Nigerian public has suffered at the hands of drug counterfeiters. Local pharmaceutical companies have lost business and lost trust as the counterfeiters mimic every new development.
People will take those tablets on the basis of trust, but they're going to get harmed because their vital organs are going to be affected. We have to keep thinking ahead of the counterfeiters. Sometimes we think like the counterfeiters. We say, assuming I was a counterfeiter, what would I do next?
Now, a new idea is catching the interest of pharmaceutical companies, allowing patients to use text messaging to check if a drug they're buying is genuine.
The way it works is that you have a scratch card attached at the back of every sachet on the product. So what patients basically have to do is that when they go to the pharmacy, at the point of purchase, they actually will have to scratch the scratch-off label. After scratching it, they have to send the code. It's a 12-digit code.
You scratch it right there and then, at no cost to the patient. We bear the costs, and we do not mind.
When they send it, they will get a response telling them if the drug is genuine or fake.
It's original.
It's original. The glucose is original.
Once you get your response that yes, this is genuine, then you can go home. You can just go to sleep because you know what you're using is genuine.
The idea has been developed by a US-Nigerian company. They hope it will become standard throughout the pharmaceutical industry.
The doctors and the pharmacists can now be surer that the product or medication they're prescribing is authentic.
The counterfeiters may one day fake the physical appearance of the scratch cards, but the technology behind the codes and texting system will be much harder to crack.
The technology is superior. You don't have physical equipment based in Nigeria. Everything is in the cloud. The numbers are generated randomly, and you can't use the same number twice. Everybody, even the not so literate, can, understand the technology of scratching and picking out the numbers. We are more certain now that fewer lives are being exposed to danger, and that what makes us happy. So if we can have more awareness, for people to just keep on scratching, it will help us.
An important initiative, especially when data from the World Health Organization suggests that there are approximately 700,000 deaths a year caused by counterfeit drugs. Now, it's winter here in the Northern Hemisphere and the nights are getting longer, and that means pedestrians are at greater risk of being hit by cars, especially if they're wearing dark clothing. Mariam Hedaripour has come from Iran and joins me now. Mariam, you've come up with a potential answer for this, haven't you? How did this come about?
A year ago, Raika Khurshidyan and I started observing the situation. We find that the rate of road traffic accidents in Iran are so high. I'm talking about 25,000 mortalities and 600,000 injuries each year. And the trouble is that World Health Organization has predicted that by 2020, the rate of mortalities in developing countries will be even double. It means that by today, I have lost 5 members of my relatives in car accidents, and I will lose 5 more members in next 10 years. So it just warned me, and I decided to do something as a design student. We noticed that there are many unsafe roads in this area without sufficient lighting during night. And on the other hand, there are many people in these regions who have a huge tendency in wearing black clothes. So especially Muslim women are all covered in black hijab, as I'm wearing one of them now.
Yes.
We came up with a very simple solution to add reflective ornaments to these wearings, which glow in darkness, and they can maybe save their lives.
That's a really good idea. So poor lighting and dark clothing obviously means the roads aren't safe at night. And you're actually wearing a chador now. So this is the reflective part, is it? The white design that we can see here. And what was the inspiration behind the design?
Well, we tried to find some ornaments which are familiar for this culture. We used Kufi handwriting, and now it is the result.
And you've got one here, haven't
Yes.
you? So this is the kind of thing that you mean. So this
Kind of a reflective sticker which can be attached to dark wearing with the heat of iron.
Fantastic, that's great. So you can actually apply it to any garment.
Yes, even bags or men and women can both use it.
Well, I wish you all the best with it, and I hope it goes really well.
Thank you.
Very much for joining us. In Bangladesh, only 1 in 4 pregnant women give birth with trained medical assistants. In an emergency, this lack of skilled help can have very serious consequences for mothers and their babies. That's why we've been following the work of the maternity hospital in Matlab and their midwives. But with so many women being frightened of hospitals, persuading them to accept help is not an easy task for midwife Sophia Khatoon.
মার মনে ফুটে ওঠে এইটা যখন আমি ট্রেনিং নিয়েছি প্রথম বাচ্চা হয়েছে ওটা দেখে আমার খুব ভালো লাগতো আর কি মিডওয়াইফারি ট্রেনিংটা আমি যখন নিয়েছি যে বাচ্চা আমি সদ্য বাচ্চা আমার যখন আমি হাতে নিয়েছি ওই মার বুকে দিয়েছি মাকে ব্রেস্ট মিল্ক সার্ভ করতে বলেছি এই যে কি একটা আনন্দ কি একটা ভালো লাগা এটাই আমার সবচেয়ে বেশি মানে আনন্দ দিয়েছে আমাকেও খুব মানে আনন্দ দিয়েছে এই ব্যাপারটা
But Sophia's job is not always this easy. Traditionally, here in Bangladesh, women give birth at home. Hospitals and clinics can be frightening places they don't want to go to. The consequences of this avoidance can be devastating. Adumani was admitted as an emergency late last night as she was giving birth. She hadn't attended her antenatal checks. Sophia has dedicated her life to prevent this from happening.
আল্ট্রাসাউন্ড করে বলি যে বাচ্চাটা বাউ আছে না উল্টা আছে কিন্তু আপনার বাচ্চাটা উল্টা ছিল তাই না উল্টা ছিল কিন্তু যদি আমরা আল্ট্রাসাউন্ড করতাম তাহলে তো আমরা বুঝতাম যে এই বাচ্চাটা বাউ না উল্টা কিন্তু আপনারা এখানে শেষ ভিজিটে 4 নম্বর ভিজিটে কিন্তু আসেন নাই বাচ্চাটা যখন অনেক সুন্দর একটা বাচ্চা এটা দেখে সত্যি সত্যি আমার অনেক কষ্ট হয়েছে বুঝছেন আপনি যে কষ্ট পেয়েছেন তা না আমারও অনেক কষ্ট হয়েছে বুঝছেন আমি নিচে হাতে বাচ্চাটাকে যখন আমি অনেক চেষ্টা করছি সাকশন দিচ্ছি অক্সিজেন দিচ্ছি যে দেখি একটা অরোডেক্সের ইনজেকশনও নাভিয়ে দিয়ে দিলাম তাই না কিন্তু আমরা আসলে পারি নাই কি করব একবার প্রাণ পাখি যদি উড়ে চলে যায় ওই প্রাণ পাখি কিন্তু আর ফিরে আসবে না খুব কষ্ট হয় যে ওরা যদি একটু শিক্ষিত হতো ওদের ভিতরে যদি শিক্ষার আলো থাকতো তাহলে হয়তো বা এটা হতো না
But it's an uphill struggle, and her next patient isn't any easier to persuade. Asma is on her second pregnancy. She's nearly a week overdue. Sophia wants her to go to hospital, where she could be induced or have a caesarean. It might save both their lives, but Asma is reluctant.
তোমার তো বাচ্চার মাথাটা এখনো উপরে এখনো 3 কাটার মধ্যে ঢুকে নাই 3 কাটার মধ্যে যদি ঢুকতো তাহলে তোমার ব্যথাই শুরু হয়ে যেত তাই না
আমি লেট কেমন হইছে কি আর কয়েকদিন যাইবো না
না তোমার তো ডেট চলে গেছে অলরেডি
মানে লেট না আর কি কয়েকদিন যাইবো না
না এখন যদি তোমার এই বাচ্চাটা 3 কাটার মধ্যে তোমার এটা প্রথম বাচ্চা না না একটা ছেলে হয়ে মারা গেছিল তো তুমি যদি এরকম দেরি করে যাও তাহলে তো তোমার এবারও এরকমই হবে তোমার এখনো তোমার ভয় হচ্ছে না তাহলে চলো এই কথাগুলো তোমার হাজবেন্ডকে নিয়েই বলে
In this traditional Muslim society, the key to getting a woman to go to hospital is often to persuade her husband. With the situation getting more critical by the minute, Sophia asks her colleague Shahjahan to help.
একটা বাচ্চা আসার আগে আমাদের মনের কি অবস্থা আমরা কিন্তু বুঝি কিন্তু আমাদের ভিতরে তো একটা আগ্রহ থাকে আমার ওয়াইফ প্রেগন্যান্ট হচ্ছে আমার একটা বাচ্চা হবে এখন এই বাচ্চাটাকে বাঁচানোর জন্য আমরা বাপ হিসেবে জন্মদাতা হিসেবে আপনার দায়িত্ব হলো এখন ওটাকে হসপিটাল নিয়ে যাওয়া
But even after they've shaken on it, the father-to-be is still not keen.
কালকে গেলে সারেন না আজকে যাও
তাহলে আপনি এখনো আপনি তো মর্মটা বুঝেন না বিয়ে হয়েছে বাচ্চা হয়তো এসে গেছে বাচ্চাটা নেওয়া
আগের বাচ্চা হয়েছে মারা গেছে
With Sophia helping to pay for the rickshaw, the young couple reluctantly head off to hospital. But the next evening, and now in labour, Asma chose to leave.
And you'll be pleased to know that Asma and her baby boy are now both doing well. A really powerful example there of how simple health education can really mean the difference between life and death. Now, Ghana in West Africa has a nationwide health service which aims to serve all its citizens. But with poor roads and many different ethnic groups speaking a variety of languages, getting access to healthcare is not exactly straightforward. So one local charity is using aircraft and education to get better health to the most isolated communities.
In Ghana, like much of West Africa, most people live in the vastness of the countryside. So getting access to good healthcare is hard. And with up to 80 different languages spoken, geography isn't the only barrier. It's a particular problem for the most marginalised communities. Cindy Yesboa is visiting a village of Fulani people. These families were forced off their land when the river was dammed, creating the huge Lake Volta. Cindy works for Medicine on the Move, a local charity determined to bring health education to Ghana's more neglected communities.
There are so many small animals that our eyes cannot see, and they can harm us. We call them germs.
Cindy has to start with the basics. In much of sub-Saharan Africa, only about half the children go to school.
You need to wash your hand not only with water, but also with soap.
This basic health education can have a big impact, but only if it's understood. So Cindy has found her role expanding in surprising ways.
F-R-O-G, frog. F-R-O-G, frog.
English is the national language in Ghana. It's used in the health service and taught in all schools. But these Fulani girls have never been to school.
Okay, very good.
And without English, they can't communicate with trained medics.
If your child is sick, you go to the pharmacy to go and buy drugs. The pharmacist gives you the drug. How are you able to know that I'm supposed to take this in the morning or in the evening? Otherwise, then you cannot take care of yourself at all. Okay, January, February, March, 1, 2. January, February, March, April, May, June. Very good, clap for yourself.
The women also need to know how to use a calendar to understand the right dates for antenatal checks during pregnancy.
If the doctor writes 2 times 3, you are able to know that you are supposed to take this drug 2 tablets 3 times daily. We give them talks that will empower them.
Teaching basic numeracy as well as language skills is allowing these people to benefit from the kind of healthcare many people take for granted.
Well, she's certainly getting the message across. That's all for this programme. Next time, Shinny will be here with a remarkable story about blood. Scientists in Scotland are developing new ways to produce huge numbers of artificial red blood cells. Their aim, to end the need for blood donations, making transfusions easier and safer. So until next time, goodbye.